The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
The difference between an integrative medicine practice and a traditional medical practice, I would say, looks at 5 different aspects that are not new to medicine, but that we are trying to bring back into the healing environment. The first one is that we don't only cure, and curing is good when it can be done, but that we also look at a person's overall health and trying to actually heal them. And I'll give an example of that later. The second would be that there is an importance that we place on the physician and the healthcare practitioners in the team and the patient's relationship. That is fundamentally important. The patient is at the center of all decisions. We explain everything that we're doing with the patient, and then we make a decision based on that. The third thing would be that we look at the least invasive, the least toxic, and the least costly methods to try and facilitate people's health. The fourth would be that we not only use all of the modalities that we already know in Western medicine, but also that we employ other complementary therapies that many patients are already using anyway, but that we know are safe and effective. And then the last thing would be that we determine what those therapies would be with the patient based on all aspects of a patient's life, their physical, their emotional, their psychological, their spiritual, and their community life. And we discuss all of those things with the patient and come up with a recommendation for their health based on those aspects. In our practice, we have 4 providers. We have selected those providers for their level of expertise in various areas. First of all, our dietitian is also a personal trainer, and she is trained in nutrition, but also in the cutting edge kinds of things of looking at inflammatory foods that cause problems with pain and joint aching. She looks at spices and things that are antioxidants. She is up to date on all the supplements that are out there because there are a myriad of dietary supplements, many of which are not healthy. So she focuses on diet, and she also focuses on exercise and movement. The second person on our team is a psychologist, and she not only is trained in cognitive behavioral therapy, but she is really there more for teaching people techniques of stress reduction, of what we call mindfulness, of being more in the present moment and not always worrying about everything and being in your head about stresses all the time. She's also a yoga therapist, and we do use yoga as a form of a moving meditation. It's also very good for flexibility and balance. The third person on the team is a traditional Chinese medicine trained acupuncturist. She trained in New Mexico, and she is excellent with many things. Acupuncture can be used for many more things than I think people realize, so she is there also. And then I'm the fourth member of the team, and so I come with the internal medicine perspective, but also with a broader perspective, I think, about looking at people's health. And we comprise the team along with a patient who is the center of that team. And so our patients see every member of the team to start with, and then we formulate a treatment plan based on the goals that the patient expresses to us about what they want for their lives. And it may not always be just about their physical health, it's about everything, how they perceive themselves, how they want to live in the next 20 to 40 years. And everyone sits down, we do a treatment plan, and then we go with the patient, we review it, and they decide what aspects they want to take from that treatment plan. First of all, there is a lot of good data out there looking at food, whole foods, and how it has an influence on our health. I think we have forgotten in medicine, unfortunately, that what we are is what we eat. We are learning especially now about all of these organisms that are in our GI tract and how they play such a role in who we are, and what we eat influences those organisms substantially. So our dietitian keeps abreast of all of the new data that has to do with foods. Sugar certainly is becoming a main issue now. We thought that lowering fat in our diet would take care of all of our problems, and in point of fact, it actually probably made things worse because we just added sugar to all of our foods. So we look at processed foods, we educate our patients on how you shop in a grocery store and what is the best way to eat. The data on acupuncture is also good for various areas. Probably the strongest data out there is on nausea and vomiting, both for chemotherapy as well as for operations. The second thing is for controlling postoperative pain. Often you can use less narcotics after surgery, which certainly helps control side effects that people have after surgery, and that's very useful. Headaches can be affected very well with acupuncture. There's good data on that. Back pain also has been studied in acupuncture. Fibromyalgia has good data. And then anxiety and stress is something that's very interesting right now and is being looked at in the military, especially for post-traumatic stress disorder. And we are using it also for anxiety and stress in our practice. The mind-body data is also quite good. If you look at what is happening in our society because of stress, we are discharging hormones that people know about for flight and fright. You know, you talk about adrenaline, you talk about cortisol. People are talking today about adrenal fatigue. All of those things have to do with the amount of stress that we are under in our world, much of which we put on ourselves. So we have good data on techniques that can alter the way that we respond. You can actually train your brain with meditation, with other modalities, deep breathing, imagery, guided imagery. With those modalities, people can affect their blood pressures, their heart rates, and all of these things play a fundamental role in their health.
We hope you'll join us for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.